Welcome to this video presentation for your anticipated colonoscopy procedure. We understand that undergoing medical procedures can sometimes be overwhelming, but we are here to guide you through the preparation and process so you can feel informed, comfortable, and confident in your decision. Hello, I am Dr. Ash Maharaj, and I will be guiding you through the consent process for your upcoming colonoscopy. A colonoscopy is a procedure where we use a flexible tube with a camera called a colonoscope to examine the inside of your entire large or thick intestine. This allows us to look for any abnormalities such as polyps, inflammation, or signs of cancer. There are several reasons why your doctor and I may recommend a colonoscopy. These include screening for colorectal cancer, especially if you're over 50, investigating symptoms such as bleeding, abdominal pain, diarrhea, or constipation, identifying and removing polyps that, although usually benign, can sometimes develop into cancer. By removing these polyps, we may prevent cancer, as well as diagnosing inflammatory bowel diseases like Crohn's disease or ulcerative colitis. To ensure we have a clear view of your colon, proper bowel preparation is essential. You will need to follow these specific instructions the day before the procedure. You must avoid eating food on the entire day before your colonoscopy. At 2 p.m., you will drink 2 liters of the prescribed bowel cleansing solution Peg-Lite. Then at 4 p.m., you will drink another 2 liters for a total of 4 liters. Stay hydrated. While undergoing the clean-out process, continue drinking clear fluids such as water or clear electrolyte drinks. Starting 2 hours before the procedure, you should not consume any food or fluids except for sips of water. For those with a previously poorly prepared colon, we recommend a 6-liter bowel preparation. You will need to follow an adjusted regimen. In addition to the 4 liters of preparation medicine like Peg-Lite in the afternoon, at 10 a.m. on the same day, take 1 sachet of preparation medicine like Pico-Salex and mix it into a mug of water. Drink it and immediately follow it with at least 2 liters of clear fluids. Following these instructions carefully, this will ensure that your colon is thoroughly cleansed, allowing us to perform a clear and effective colonoscopy. Sometimes, if stool is obstructing our view quite significantly, we may stop the procedure before we finish assessing the entire colon. If the bowel preparation is poor, we would recommend for you to return sooner for a repeat colonoscopy with even more bowel preparation. On the day of the procedure, you'll have the option to undergo the colonoscopy with or without sedation, but we generally recommend sedation. Sedation enhances your comfort, relaxes both your body and your colon, and allows for better visualization of your colon. You will need to arrange for someone to drive you home and stay with you for a few hours after the procedure, as you are advised to not drive, travel on your own, operate machinery, or make any important decisions for the rest of the day. During the colonoscopy, I will gently insert the colonoscope from your bottom up through your left side, across the top, then down to the right side, examining the entire colon. The procedure typically takes about 20 to 30 minutes. If we find any abnormalities like polyps, masses, or inflammation, we can remove them or take samples during the procedure and send them for examination by a pathologist later. The results will be available in about a few weeks. If there is something concerning, we will contact you. A copy of the results will be forwarded to your family doctor. Next time you see your doctor, confirm that the polyps or samples are of no immediate concern. Following your colonoscopy, you may experience some bloating, gas, or mild cramping, as the air used during the procedure passes through your digestive system. These symptoms usually resolve within a few hours to a few days. You may return to eating normally after the colonoscopy. While colonoscopy is a generally safe and routine procedure, it is important to understand that, like any medical procedure, there are potential complications and risks, or the likelihood of the complications occurring, which include discomfort or pain. Inserting the colonoscope can cause temporary discomfort or cramping, especially during the initial insertion and as we advance through the bends of the colon, even more so if the colon is poorly prepared and/or long and twisty. There is a small risk of bleeding, especially if we need to remove polyps or take biopsies. Most bleeding is minor and stops on its own, but if you experience heavy bleeding or pus clots, get dizzy or faint, you should seek medical attention. Although very rare, there is a risk of perforation or making a hole in the wall of the colon during the procedure by accident. If this happens, we may notice it during the procedure and try to close it. If we do not, you may develop steadily increasing pain, abdominal bloating and pressure, difficulty breathing, weakness, dizziness, and fever. If this occurs and you are unable to reach my office, please go to the nearest emergency department for further investigation and treatment. Rarely there are potential risks associated with anesthesia or sedation, such as allergic reactions, difficulty breathing, or heart issues. It is important that you do not eat anything for at least 24 hours before the procedure to reduce the risk of anesthetic complications, especially breathing problems. Intravenous complications can also occur, which may include swelling, inflammation, bruising, blood clot, and infection. If you experience severe pain or unusual symptoms after the procedure, please contact us immediately or seek emergency care. Although exceedingly rare, there is a small increased risk of infection following a colonoscopy. Symptoms may include dizziness, fainting, lightheadedness, chest pain, and shortness of breath or anything else of concern and out of the ordinary. Again, you should seek medical help in the emergency department and call us immediately. In very rare cases, there may be a risk of missed polyps, masses, or other lesions, particularly if the bowel preparation is poor and your colon is filled with stool. If you do not recover completely for any reason, please let me and my office know of your difficulties and we will try to help. If you prefer not to undergo a colonoscopy, there are alternative options for screening, such as a FIT test or a fecal occult blood test. These stool tests can detect hidden blood in your stool, which may be a sign of cancer or polyps. A CT colonography, which is a specialized CT scan that provides images of the colon, can also be done. However, unlike a colonoscopy, these tests are diagnostic only, meaning no biopsies or treatments can be performed if abnormalities are found, which in the end would likely require a colonoscopy anyway. It is essential that you understand the nature, benefits, and potential risks of the procedure, as well as any alternatives. If during the procedure we discover an abnormality that requires additional treatment, I may recommend further action in real time to ensure your best care. Please leave your valuables with a family member before coming inside the clinic. As we are a procedure-based practice and do our best in caring for all of our patients, ensuring everyone's understanding and taking great care in performing the procedures, you may not be seen exactly at your scheduled time and may even be waiting for a few hours. We ask for your understanding and patience. When it is your turn, we will also do our best to give you high-quality care. Thus, please do not make plans for at least 6 hours after your procedure. You would likely be spending at least 2-3 hours in our clinic. Thank you for taking the time to watch this video and learn about your upcoming colonoscopy. We are here to answer any questions or concerns you may have, and we will be with you every step of the way. Remember, I'll be behind you the whole time. You will be asked for a code to verify that you have watched and understand the contents of this video. Please write the code above CY924 in your consent form. Thank you.